Medical bill to make you sick. Some of you won't even sleep tonight because of this crushing medical debt that you're under. Bills some didn't even know about. Oh, and here comes the mounting pile of debt and penalty fees, forcing many into bankruptcy, many losing their homes. Now the state leaders are working to make sure that doesn't happen. Let's go to WMAR 2 News' Ray Strickland live tonight at the University of Maryland St. Joseph Medical Center. Ray, there's now a state bill designed to give patients more protections.
Yeah, Jamie, and the number of these cases in Maryland is only growing. COVID-19 certainly isn't helping much either, which is why lawmakers are focusing on assisting Marylanders who seek care at hospitals don't end up hurt in the long run by medical debt that can often be avoided entirely.
Having 100% coverage, you assume that it's 100% covered.
Ashley Esposito successfully gave birth to her son last year, the end of a long 2-year process that started with multiple rounds of IVF treatments. Esposito thought her insurance covered all the costs until she got a $2,000 hospital bill a month before she gave birth. The problem, it came a year after her first hospital visit.
We're enjoying having this baby that we fought so hard for. And then all of a sudden we start getting collection calls and they're treating me like I'm a criminal. And I'm sitting here like, what is going on?
Esposito was not sued for the past due balance because she started making payments before it was too late. But for years, many Marylanders have lost their homes and gone bankrupt for failing to pay medical bills. That's because, according to National Nurses United, Maryland hospitals filed more than 145,000 lawsuits between 2009 and 2018. Now, a bill to protect Marylanders from medical debt is poised to become law. It will add key protections for patients that will bar hospitals or collection agencies from placing a lien on a person's home, from garnishing their wages, and will also require them to offer an affordable repayment plan.
The bill also includes provisions about notification processes for hospitals to make sure that patients understand that they qualify for reduced cost care or for free care even.
Valerie is the lead organizer for the End Medical Debt Maryland Coalition. She says half of the lawsuits are for less than $1,000, a practice she describes as predatory because it disproportionately impacts low-income families and communities of color. She says this bill is the first step to protect Marylanders from being punished for seeking medical care.
This will be huge for thousands of Marylanders who may fear pursuing healthcare for fear of the costs.
And I do feel like the doctors care for people. Now it's time for their finance departments to do the same.
And the Maryland Hospital Association, who opposed the portions of this bill, sent us a statement saying, in part, Maryland hospitals remain committed to delivering the medical care people need without imposing financial hardship. As for this legislation, there's two versions in both the House and Senate. They'll both, or I should say, they both pass unanimously out of committee. And also worth a mention, the End Medical Debt Maryland Coalition will be holding a rally to voice their support on this legislation on Saturday. Live in Towson, I'm Ray Strickland, WMAR 2 News.